my practice is one that focuses on sports medicine and then all tenets of kind of performance, whether that's athletic performance, cognitive, really uses the science from sports medicine, sports science, and brings it to the rest of us. Most of my patients are, about 70% of my patients are professional athletes. 30% are recreational guys like me who enjoy getting out and being competitive, but don't make a paycheck from it. And we started using Heads Up, about 6 months ago, really as a way to dig deeply into some of the metrics we gather and follow on our patients. My practice is a mix of remote and in-person. I'm also the medical director for a world tour cycling team, like a Tour de France team. And in that team, we have various, dashboards and tools that we're able to use to keep track of our riders, our patients. And so within my practice, I was kind of monitoring a lot of the same metrics, be it, hematology and blood work, sleep from Aura, Whoop, recovery metrics, daily weigh-ins, training load, all kinds of stuff. But in my practice, I didn't have the same tool to kind of put that up on a dashboard, either view it quickly for all the patients or dig in deeply for individual patients. So when I started looking for options, I came across Heads Up and saw that it basically was providing exactly what I wanted to have for my patients. And not just that, it had a component to it that was very malleable, that you guys were willing to kind of put in things that would be helpful for me, and we could get rid of stuff that I'm not using and really tailor it to what I need, so that when I sit down with a patient, which can be in my office, it can be remotely, a lot of times it's at events. So I work with a lot of PGA golfers, Ironman triathletes, a lot of times it's me being where they are and being able to pull this up and go over it. So it kind of just ticked all the boxes for me. One of the most recent features that I think has really made Heads Up more, just has really increased the value in terms of how we utilize it day to day, is the analytic function. And we've rolled this out with some of the assessments we do. So when we bring a patient on, we'll do blood work, and we'll dig into their health history and look at their medical records and start to monitor sleep or look at what they've done in the past. And so that's kind of a starting point. What we want to see is, from that point, when we make interventions, how does it change things? Hopefully for the better, but not always. I mean, there's some guess and check and there's some individuality. And so being able to keep an eye on things and trend them is really important. The analytic function, for instance, we've started using it in our sleep assessments. So when I sit down with a patient, we may look at their last month of sleep metrics and graph that using the analytics. So it may be total sleep, deep sleep, REM sleep on one page. We may look at HRV and HRV-CV on another. And not only just look at the last month, but then compare that chunk of data to, say, a month or 2 months or 3 months that happened, in the past, 6 months ago or a year ago. So we can see where they were prior to an intervention and where they are now post-intervention. And that, I think, is really powerful, both for us as practitioners in checking what we're doing with patients, but also in giving them a kind of a rationale and some confidence in what they're doing. In medicine, a lot of times the tests we run, we kind of know what the answers are going to be. I mean, not all the time, but a lot of times the data really serves to be a reminder to the patient and push the patient and say, okay, you're making progress or you're not. And then they say, oh, well, I haven't been compliant. And, okay, now I'm going to try to move that number. It kind of gamifies it. Biggest benefit from an overarching theme standpoint is that we collect so much data on our patients from varying sources, whether that's the Oura Ring or glucose monitors or scales or blood pressure. But we typically look at them in isolation. Even if we try to combine them, like try to look at them together, it's pulling, it's having two screens up and having one here, one there, and trying to figure out how it's coming together. So this is a tool that allows you to pretty much overlay whatever you want. So I'm in sports and performance, and the way my dashboard is set up and my analytics, it reflects that very obviously if you were to pull it up. But if you're in managing chronic illness or diabetes or any number of things. Like, it will look different for you, but the idea is the same. You're pulling in the metrics that are important to you. You're getting rid of the ones that aren't, so it's not overwhelming. I think that's really important because it comes just noisy otherwise. And you can really focus down on the interaction between important variables. I would certainly recommend playing around with it and seeing if it fits your practice, because I think it's very malleable and will fit lots of needs.